Welcome back to 90 Day Dental Day 34. It's a pleasure having you back. We started the Perio section yesterday with the classifications with Ian Dunn, and today we're going to talk about the differences between health and perio with Hatem Algraffee. Take it away.
Hi everybody, and welcome to one of the series on 90 Days Dental. Today I'm just going to give a brief outline on health and periodontics. It's a huge topic, but I just want to give you a few ideas to think about. So let's go. As we said, this is part of the 90 Days Dental coronavirus series. I'm just going to go over a few things just about gum disease, which is obviously periodontitis, and its role that potentially could have in systemic health and disease, and what systemic conditions may influence gum. Now, in an ideal scenario, you can see the situation where the gum tissues are nice and healthy, looking nice and pink, and that's your perfect gum condition. We come on to a stage where, unfortunately, that may develop into something a bit more advanced, and this is your gum disease, what we call periodontitis. Now, we come on to when we take some x-rays, unfortunately, you can see there's a significant amount of disease. There's a lot of bone loss. In the mouth clinic, you'll see a significant amount of gum pocketing, but on the radiographs, you'll see a significant amount of bone loss. And we know the main causes of gum disease tend to be quite a multifactorial. Now, when we come to talk about periodontitis, we need to know it is in the top 10 of diseases around the world. Some people say it's in the top 20 for inflammatory diseases. Inflammatory diseases tend to be the worst in terms of what was challenging for us currently. 80% of the population will have some form of gum disease, and approximately 15% of the population will have advanced gum disease. So that's a significant amount of disease, and it reflects, how serious we must take this. Now, currently, I'd probably say about the last 10-15 years, there's been a big push in terms of what role gum disease may have with systemic diseases and vice versa. And some people ask, well, this has been recent. It hasn't. Going back to 1900s, Hunter started to identify the relationship between all diseases, i.e. decay, gum disease, and also systemic disease. Now, if you look at this slide, you'll see chronic being long term. We don't use the word anymore chronic, but we use the word periodontitis, i.e. gum disease, has a significant amount of association that we need to appreciate. There's sometimes a difference between association, cause and effect, but there's a significant amount of evidence suggesting there's an association with cardiovascular, diabetes, premature babies, respiratory disease. It goes on, rheumatoid arthritis, mainly those associated with inflammatory conditions. And significantly, it's going to be one of the biggest challenges that we have, both in terms of age group, in terms of 40 and above, but also in terms of our lifestyle. Now, with the main modifiers of gum disease, we know the main risk factors tend to be oral hygiene, smoking, genetics, and health. We'll come on to smoking later on. Oral hygiene is a different factor, but obviously the main factor. But we now appreciate that systemic diseases, medications, and nutrition well-being have a significant part and role to play. Now, gum disease, as mentioned, can be associated with a significant number of conditions, and I've outlined these here, and these are just a few, as you saw on the previous slide. And we're now beginning to realize also it's affecting every single age group from 40 and above. It may even affect those in the younger category, especially if they've started to smoke. And also we have to look at the genetics. Some people are more prone, have a predisposition to certain conditions, whether it's cardiovascular, whether it's respiratory, whether it's diabetes or equivalent. So we need to start identifying this and having a better holistic view of how we're going to address these conditions. Now, gum disease and diabetes, significant. We know is what we call bidirectional, i.e. gum disease can affect your diabetes levels, and diabetes levels can affect your gum disease. So this is one of the most significant conditions that we're aware of. It's a worldwide problem. It's not just in certain continents. It is a worldwide problem. Some people associate it with obesity. Some people say our lifestyle, whether with refined foods, sugars, etc., etc. But there's a significant amount. We know diabetes has macro and microvascular issues, which will most likely affect most of our organs and most part of our body. So something we must take serious, and we need to work with our medical colleagues with all these conditions and notifying them that these patients are more susceptible. Where if you have diabetes, potentially you should be screened for gum disease. And if you've got gum disease and it's advanced and generalized, we need to start asking ourselves questions. Are there other factors that may be contributing or having a role? Now, as I mentioned, diabetes is a global epidemic. It's about half of those affected actually aren't aware that they've been diagnosed with it. So again, we must, try and help our patients, because some of them may not be seeing medical practitioners, and vice versa. We know that 80% of the population will have some form in the 40s and above, and we need to also appreciate in the next 15 years there's going to be an increase in morbidity, i.e. side effects of conditions and diseases from diabetes, and also mortality, which unfortunately as a result of diabetes. So from our point of view, anybody who has generalized advanced gum disease and they're a non-smoker, we tend to screen them for diabetes, and it's something we're doing routinely, have been doing so for the last 15 years, and we've picked up quite a few cases. And again, we need to ask ourselves, if somebody has too much of a disease condition, we need to ask why, and we need to sort of investigate that. So it's well established that diabetes has an effect on the gum disease and vice versa. As I said, there's a high risk, and the reason why I'm focusing on diabetes because I think it is one of the biggest challenges, but we also need to screen our patients and also be aware of other complications, dry mouth, burning mouth, and also candida infections. Smoking, again, we screen all our patients in terms of smoking. We identify them as never smoked, previous smokers, current smokers, and the new trend now is e-cigarettes. And we now begin to have evidence that that can have an effect, because again, it does have nicotine in it, so it will have a role in has a vasoconstriction of the blood vessels. And there is data to suggest there is a dose related with time. So we know the more you smoke, the longer period of time you smoke, the more susceptible you are going to be in terms of gum disease. And it has been attributed, about 40% of gum disease cases can be attributed to some form of smoking. So big problem, and something that, again, we need to identify as a major risk factor from a health, but also from a gum point of view. We've also come on to atherosclerosis, cardiovascular, again, one of the biggest killers around in the world. Partly can it be due to diet, social, genetic, but again, we're now beginning to find some of these bugs. Some of these gum disease bugs are located in these vessels. So again, we begin to find a significant amount of association. Is it cause and effect? We're not 100% sure, but these patients tend to be the same category. They tend to be smokers, poor diet, less exercise, diabetics, again, genetics. So again, the risk factors associated needs to be identified, and we tend to now investigate and ask patients, have they got a history in the family? Are they obviously smokers? Their diets, nutrition, exercise. So we know it will affect some of the outcomes. And even when we try and stabilize the gum disease, if their dietary, smoking, exercise, etc., isn't addressed, then they may find a deterioration in their health, which will indirectly or directly, as the case may be, affect their gum condition. So if you look at the bottom of the screen, you can see diabetes, obesity, smoking, and again, all these risk factors are related to gum disease and obviously health. So we need to start identifying there is a role in terms of the bacteria associated with gum disease can have an effect. We did this research on CRP, which is C-reactive protein. And again, that will show there is an inflammatory marker happening. Diet, I mean, the main thing tends to be, as we know, a good healthy diet is a scenario of trying to keep your health and body and mind in shape. And that has a similar effect. Are there any particular vitamins and minerals? No, not really. We know scurvy and vitamin C, but we don't tend to see those cases. But a good balanced diet. But again, we tend to know that vitamin D, vitamin B, we test for that. Folate in terms of patients who have gum disease. So we tend to identify any of those patients who've got generalized disease where there are any potential risk factors. But a good controlled diet should be sufficient enough. As I mentioned, scurvy, we don't tend to see, but a good healthy diet. And again, there is too much gum disease and the risk factors of oral hygiene, smoking aren't identified as being an issue for one particular patient, we tend to do some blood testing for that. And as I mentioned, anybody who's got advanced generalized gum disease, we tend to investigate them. Very quick blood test with their general medical practitioner for thyroid, diabetes, iron, zinc, vitamin D, vitamin B, and obviously HbA1c diabetes. And again, if we identify those risk factors, we can identify anything that can be associated systemically, which may affect the gum condition. Osteoporosis. Again, I recall reading some data on this quite some time ago, and also rheumatoid arthritis. And again, about 10-15 years ago, it wasn't seen as a risk factor, but it is now. There are some studies that have shown patients who are on HRT or equivalent have less risk factors in terms of tooth loss and have better improved outcomes. So we need to start looking at those and trying to, and again, we see patients who go acute phases of deterioration, whether it's arthritis or equivalent, and we notice that the gum condition deteriorates. Let's say when they go through their peaks of acute condition. Now, Alzheimer's is the latest one that has been identified, and some research has started on that. And again, they found gum disease bacteria in Alzheimer's brains. So again, we are noting that the systemic effect of gum disease is systemic, so in the bloodstream. So we need to start looking at other conditions that may be associated, I use the word, and also try to identify those that have a cause and effect relationship. And the other thing we're looking at, obviously, is the most common daily things are halitosis, poor hygiene, throat infection, gastroenteritis. All these conditions can affect the general oral health. I hope this was okay. This is just a brief outline, hopefully just to get you guys a bit stimulated, but this is a huge topic. If you have any questions, by all means, email me. Just a big thank you for those who've taken the time to listen to this, and I hope to see you for the next series. Thank you.
Another superb session, and Hatem will be back later in this series for another section. But until now, join us again for part 3 tomorrow.